They're calling the companies and calling the companies, but no response is being made. So, yeah, we're seeing those kinds of trends in our office.
This gives us a very good perspective, a glance into the inner workings, how healthcare dollars are getting spent not for good purpose, and which has a great impact. I know with all the discussion of healthcare reform, there has been a much greater emphasis on trying to recoup these dollars. Have you seen changes, Ian, in what has in the policies or in the resources that have been available to you in the last year or two?
From HEAT, I know we have hired a lot of new agents. As far as resources, we're getting a lot more from headquarters, and the more we get, the more we can produce, obviously. And we actually needed more agents for years, and now we feel like, okay, we still got a lot of work, but we're getting somewhere, and every dollar counts.
Good.
So.
Good. We're going to take a break now, but when we come back, I'd like to talk not only about what the instances are of healthcare fraud, but what our viewers can do, you know, how they can make a difference, either by being educated or reporting the fraud, getting an understanding of that concept. So we will take a short break and be back with you.
Hi, I'm William Mapother. I play Ethan Rahm on the TV show Lost. Let me tell you about a truly lost population. Every single day, thousands of our elderly citizens are subjected to abuse, emotional, financial, physical. Worse, the majority of people who commit these acts are those closest to the victim. Please join me in the fight to end elder abuse. It's time to speak up. Our elders deserve better.
During the first segment of the show today, we've been discussing the programs working to prevent and fight Medicare and Medicaid fraud. Rejoining us for this segment are Makiba Huntington-Simons, the program manager of SMP in Florida, Carol Conry, a law enforcement lieutenant with the Medicaid Fraud Control Unit, and Ian Ives, special agent with the U.S. Department of Health and Human Services, Office of the Inspector General. During the first segment, we went through some of the background of what is happening out there in terms of fraud. Let's start off by talking about how, if our viewers are watching, when you get the word out in the communities, and someone finds that they have an irregularity or something doesn't seem right, where do they start? Makiba, how do they report that?
Sure, they can call our 800 number, our 1-866-357-6677. That's our SMP hotline. They can talk to one of our bilingual contact representatives, and she will in turn ask them to send in their information with the release of information form. And from that point on, once it has been determined that there is fraud, we send it on to our zone program integrity contractor, and they take a look at it, and if once they've exhausted all that they can do with that, they send it on to more than likely OIG and some of our law enforcement folks to follow up on.
Okay. And what are some of the examples of things that people might call in to report? Some of the things that we've already discussed, of course.
Yes, durable medical equipment. Yes, that's prevalent. But lately we have been getting a lot of calls about the Medicare Advantage plans and the marketing tactics that they're doing, specifically in South Florida.
Okay. Yes. And Carol, you also have a procedure that is in place for people to report Medicaid fraud, if it's specifically Medicaid?
Yes, similarly, Marilyn, we have also a toll-free number of 866-966-7226 that they can call at any time, and someone will be glad to take the information from them. And recently we've had the state legislature has actually funded a program to send out explanation of medical benefits to the recipient so that they can tell exactly what services are being billed under their recipient number. and we ask please that they review those and make sure that what's on them is correct, if they actually had those services or not, if there's billing for services not rendered, or sometimes we'll have an upcoding type of situation where, as I like to say, you get the Volkswagen, but they bill for the Cadillac. So
if you've gotten a wheelchair and they're
yep.
billing for a motorized
Absolutely,
scooter, or
right.
You had a very brief visit to the doctor and it's billed
as a very long visit, correct. So we surely would like to hear from people about that, and the state has now started a rewards program for the people that do call in if they are an original source, and when we are able to prove the allegation, the program will pay up to 25% or $500,000, either of the two, depending on what we recover, and if we're able to get a successful either prosecution and or civil recoupment of the monies. So it's quite a program.
Yes. We'll be interested to see how that plays out. Are you getting more reports as you have publicized this reward?
We are getting more reports on both sides because of the reward, as well as the more of the explanation of medical benefits going out to the recipients now, and they're seeing exactly what they have been being billed for.
Right. And Makiba, am I correct? Medicare sends out the Medicare summary notice, so in a similar way, although there's not a reward for that program, but there is the need to review.
Yes, there is a need to review your Medicare summary notice or your explanation of benefits. That's the first line of defense against Medicare fraud. Yeah.
What happens after? Now, Makiba, you have explained if someone reports an irregularity or potential abuse or fraud to the SMP program, how you take a look at it and then refer it on for investigation. How is it handled with the Medicaid Fraud Control Unit? If there is a report, what happens?
Well, similarly, we will then go in and we're going to start reviewing in our data banks the billing that has occurred, and we're going to do some peer reviews and see if there's some aberrant billings that might be there for that particular provider. And we may go out and interview some other recipients to see if they've gotten their services, and then ultimately probably visit the provider and actually get the records to see what it is exactly they may have put in there. So.
And Ian, you're looking at this from the law enforcement side. What happens there when this comes to your office as a potential abuse or fraud?
Well, we get these hotline sheets where folks have called into the hotline, and basically, if they put a name and number down, the agents that's assigned that will call the witness or the complainant and figure out what has happened. Because a lot of times, we need to know if this is something that's been reoccurring around the area, or a lot of times within our hotline system, they could cross-reference the provider to give us more data to see if there's past complaints. And then we could look at past reports and see that, okay, well, this doctor or this provider has been complaining on so many times. Maybe we got to look at their data again, because if it was open one time, then the data was already looked at. But if it's a change in pattern, we have to pick up on it. Then we have to interview more beneficiaries who had the same provider, and then we determine that, okay, we have a pretty good case, we have to go after them. Because due to limited resources, we have more resources with the HEAT task force, but even with that, we need more. And we cannot open every case that comes through our door, which, I mean, we want to help people, but it's just that, you know, we have to pick and choose the case that we could actually work and go through the end. But we make a very good effort trying to talk to every complainant or witness that, you know, that's sent our way.
It sounds like, you know, one of the things you're looking for is extent of the problem, either in terms of pattern or dollar amount. Is it possible that if someone is calling in with one complaint or one concern, that can precipitate, that can be the start of a whole investigation?
Yes, it can, absolutely. Yes,
okay,
for
so
sure.
It's important for beneficiaries and recipients to closely watch what they're doing and you know, what they are receiving, both in terms of care as well as in terms of the reporting through their MSNs, their Medicare summary notices, their explanation of medical benefits. And they can make a big difference by making that call.
Yes, they can.
To one of your hotlines. We are going to be running that hotline number throughout the show, so hopefully our viewers, you will take it down and keep it handy so that as you review your information, you call in if there is a problem. Let's talk some about how to prevent prevent. You know, obviously you're working very hard on recoupment, prosecution. Best effort, though, is to prevent it to begin with. And Makiba, that's a specialty that the MS, that your program has.
Yes.
Tell us some of the keys to prevention.
Sure. As we spoke of earlier, reading your MSNs or your EOB is very important. We also hand out a personal health care journal to the people we meet in the community, our volunteers, and we encourage them to share this health care journal with people they meet. And they can take this journal with them to the doctor, write down all of their prescriptions and their durable medical equipment, and compare it to their MSNs. Make sure that they are being billed for services that they received. That's what we're stressing with SMP through the SMP program.
I keep hearing there's a necessity to protect both your Medicare and your Medicaid numbers, that they should not be given out unless it is to a provider that you have an arrangement with, or you know, if you have, I know with our SHINE program, which is a volunteer program also that provides Medicare counseling, when people call in and need assistance, there is a need for their Medicare number, but the consumer has initiated that call. When you get a call, a cold call, and someone is looking for that information, you should be very hesitant to provide
I think it would be similar, Marilyn, to equating it to a credit card number.
Yes.
You know, you wouldn't give a credit card number out to someone who just calls as a cold call. So very similar. I would definitely consider that they should protect it just as they would a credit card or a bank account number.
But you would be surprised, Marilyn, many people do not realize that that's their Social Security number on their Medicare card. You know, we've questioned people, you know, about, you know, do you have your Medicare card with you? Yes, they have their Medicare card with them, and we tell them you don't need to bring your card with you unless you're going to the doctor. But they, you know, we just have to keep educating our people in our community how to treat it.
Do you find that some of the cases that you're working on, Ian, revolve around Medicare numbers that have been obtained improperly and then abused?
Yes, actually, one of my first cases that I worked a couple years back, it was a lot of beneficiaries out of the Miami area. Their numbers were compromised and used at a storefront clinic in Orlando, where it was pretty simple because, I mean, we knew that the beneficiaries were not traveling to Orlando to get their services. So my thought was, okay, I'm going to drive down to Miami, talk to these folks, and find out what was going on. And it turned out basically that most of the doctors that they were going to, they were legitimate doctors, except that they had an anomaly. Every one of these doctors had referred the beneficiaries to a certain other diagnostic clinic. And that's where the numbers were compromised, probably sold behind, you know, closed doors. And then it was used, and these numbers keep traveling from fraudulent clinics all over the country. So providers have to be mindful. If their patients, their beneficiaries is coming up to them and says, well, we went to that place and then we felt kind of funny. Now that's the first sign of the provider should say, well, maybe I should look into this, or maybe I should call law enforcement and say that, you know, we have to look into this, because if we could stop the bleeding when it's still just a paper cut, then we could do something about it. But once it gets out, it's very hard to contain it.
So providers are also key in this battle.
Yes.
We're coming to the close of the show, but I wanted to talk very briefly about volunteers, because your program, the SMP program, is very much based on volunteers. And how do you obtain the volunteers? If someone in our audience feels that, you know, they want to become more active in this fight, what do they do?
Well, they can call the 800 number that you're going to show, and or they can contact us via email, contact the agency.
And what do they, as volunteers, what is it that they are doing?
They can do a number of things. If they are local, we do encourage people to come into the office and help with the fraud line. We have volunteers out there who strictly want to do community events. We have folks who really want to spread the word in the community and be presenters with SMP. So, yeah.
Okay. It takes a team to fight this, and I so greatly appreciate not only your being here today, but the efforts that you make every day to fight the healthcare fraud that we have. I thank our viewers for joining us for the show. I hope you have found it informative.